Hi, I'm Melissa Johnson from Allwell Behavioral Health Services. I'm here today to talk to you about suicide, signs, prevention, and where to go for help. A few facts for you that come from 2018 data. Unfortunately, that's the newest data that we have currently. Suicide has been known to be the 10th leading cause of death in the United States. About 132 people per day die by suicide. And with all of those deaths, there is at least one additional attempt about every 26 seconds in our country. Approximately 50% of Americans have been impacted by a suicide death. It was believed that only 6 people were impacted by a suicide death, but research is now showing that approximately 135 people are impacted by each suicide. So when we're looking for signs of suicide, we look for a couple of key things. While there's sometimes no signs at all, more often than not, there typically are signs. We look for changes in usual behavior. Usually those behaviors are decreasing. Things that we normally do we tend to stop doing. And we also look for the addition of new behaviors. We break these into 3 categories. We look at common talk of suicide, common behaviors that are associated with suicide risk warning signs, and also common moods that we see typically before a suicide. In terms of common talk, people often will talk about suicide or talk about killing themselves. We've always kind of had the myth that if someone is saying that they're suicidal or telling people that they're going to kill themselves, that most often they won't, and that those who are quiet about it and don't say anything are more likely to actually die by suicide, which is not true at all. Some people just feel more comfortable talking about it. You might see feelings of hopelessness, talking about things like there's no point in going on, there's no point in going to work, no point in doing things with your family. They may say that they have no reason to live. They may feel like they're a burden to others. May say things like, my family and friends are better off without me. They may talk about feeling like they're trapped or stuck. They may also talk about unbearable pain. That may be physical pain, that may be emotional pain, depending on the situation, a lot of times both. Some common behaviors that we see prior to a suicide attempt, or when we know folks are thinking about suicide, there may be an increase in using drugs or alcohol. A lot of times drugs and alcohol are used to numb the pain that they're feeling or to escape. They may be looking for a way to end their lives, such as searching online for methods to end their lives. They may be gathering items, medications, tools, that kind of thing. They may be withdrawing from activities. This is a big one, especially with kids and youth. Withdrawing from their friends, withdrawing from their family, maybe calling off work for adults. Isolating from friends and family, not going to get-togethers, going to a room straight after school or straight after work rather than having dinner with the family or sitting around watching TV in the evenings. They may be sleeping too much or too little. They may even go and visit people that they loved in order to say goodbye, possibly not outright saying goodbye or I'll be gone, things like that. Usually just one last visit. They may be giving away possessions that they have. We see this especially in older folks, giving things to their family ahead of time, maybe selling vehicles, selling houses, things like that. We often see a lot of aggression. Usually this is a sign of pushing people away so that they don't feel like they're hurting them as much. And we often see fatigue, just feeling really tired. It goes along with the sleeping too much, just feeling very blah. We also often see mood changes. We see depression, And that may be increasing over time. Anxiety, that could be anxiety about whether or not they want to make the decision. Loss of interest, just like the not going out with friends and family and isolating from others. Irritability. They may feel humiliation or shame about the way that they're feeling or about maybe the disorders that they are dealing with. Could possibly be something that they've done or have thought about doing that they maybe feel humiliated or shameful about. We often see agitation and anger again. And sometimes we see relief or sudden improvement in folks. A lot of times that's because they've come to terms with having made the decision to take their life. So in terms of prevention, what can you do if you feel like a friend or family member or somebody that you know may be thinking about suicide? The first thing, have an honest conversation with them. Talk to them in private if you can. Listen to their story and listen carefully. We want to make sure that we're listening to listen and not listening to respond to what they're having to say. We're not there to fix what's going on. We're there to support and listen. Make sure you tell them that you care about them. The biggest thing is ask direct questions. This is a scary topic. It's scary to actually know the answers to your questions. But a lot of people will skirt around the issue if we don't ask direct questions. Ask things like, are you thinking about killing yourself? Are you thinking about wanting to die? Encourage them to seek treatment or contact their doctor or therapist if they have one. You want to avoid debating the meaning of life with them, minimizing their problem, or trying to give them advice. Again, just be there to support them, listen, and I will give you some numbers and some information on where to go if they are indeed thinking about suicide. If the person does say that they are considering suicide, you want to take them seriously. We never know. There have been times that folks say things like, I'm just going to kill myself, when they are very overwhelmed with something. And they may or may not mean that, but we need to take it seriously. You want to stay with them, don't ever leave them alone, and you want to help them remove any lethal means. By that, I mean any access to guns, maybe knives, maybe medications, help them lock things up so that they don't have access to that. Talk to a family member to make sure that they don't have access to these things. Moving lethal means away from the person is a really good prevention measure. It's often thought that people will find any way to kill themselves if you remove the one thing that they were thinking of, but that's not necessarily true. So where can you go for help? We have a lot of numbers here locally and nationwide. Allwell Behavioral Health Services operates a crisis hotline that's 24 hours a day, 7 days a week. That goes out to our crisis stabilization unit, and it's answered by mental health professionals. The toll-free number is 1-800-344-5818. You can also call locally at 740-453-5818. We also have the crisis text line. This is a nationwide thing. The Ohio line is you text 4HOPE to the number 741-741. Again, those are mental health professionals. They will answer your text within 5 minutes. We see this a lot with younger folks who would rather text than call. They do have ways of tracking folks if that's necessary, and a really great resource. The National Suicide Prevention Lifeline is 1-800-273-TALK, which is 8255. That is a national hotline. However, it's answered locally. It gets answered at our 211 call center in Licking County. And again, mental health professionals are available to answer that line. You may need to escort them to mental health services or to an emergency room, depending on the situation. You are always welcome to come to any of the Allwell Behavioral Health Services locations in any of our 6 counties during business hours, and we are happy to do what we call crisis intervention and find out what's going on The biggest thing is you don't need to know exactly what to do in this situation, but to get them to professionals that can help. For any other information or assistance, you can call us at Allwell Behavioral Health Services. Our main number is 740-454-9766, or you can call the Mental Health and Recovery Services